Hospitals at full capacity, pharmacies out of medicine, a scene familiar to healthcare systems during the COVID pandemic, but now there's a trifecta of viruses sweeping the nation.
Cover up and, stay safe so you don't spread the virus and potentially give it to someone else.
Mask up, New York City. Health officials issued a strong advisory recommending people wear a facial covering in public, indoor settings, or crowded outdoor settings. Now, with the holidays upon us, what does that mean for you and your health?
Hackensack Meridian Health Chief Clinical Officer Dr. Thomas Bader joins us. What is this tridemic?
So it's really not a very complicated phenomenon. Every winter we have a bump in cases of respiratory syncytial virus, RSV. Mm-hmm. Every winter we have an increase in cases of influenza, flu. Mm-hmm. And for the past 2 winters, and I'm sure this will be the 3rd winter, we'll probably see a bump in COVID. The confluence of all 3 of these rises, all happening at a somewhat similar time. That's number one. And number 2 is the concern that both the RSV increase this year as well as the flu increase this year have both been earlier and more intense than we see in typical years.
Dr. Bruce Farber is the Chief of Public Health and Epidemiology at Northwell Health. And so what are the symptoms to look out for? I know there's the classic runny nose, sore throat that might overlap, but talk to me about what differentiates these 3 viruses.
Well, from a practical point of view, the viruses are as different as can be, and we can talk about that. But unfortunately, from the symptom point of view, they overlap tremendously. And you can have some hints. For example, if you've lost your taste or smell, you can almost be certain that the virus is COVID because the other viruses don't do that. If you have the very sudden onset of your symptoms, meaning within an hour you go from feeling pretty good to pretty miserable, and you have very high fever, that's much more likely to be influenza. And RSV tends to usually, at least in adults, not be associated with fever. In children it can be, and it's sort of like a bad cold that in young children, particularly those under the age of 6 months, causes bronchitis, bronchiolitis, difficult breathing, wheezing, and the like.
Who's most at risk here?
The very young, the older population, those with immunocompromised or chronic conditions, and pregnant women. Those are the groups that we really would focus on for the greatest concern with any of these viral infections. But you add pregnancy and the risks for complications are much greater. That's why it's so important for all pregnant women to get vaccinated against influenza and against COVID.
And RSV basically is also a disease primarily of young children. And the deaths and the morbidity and the hospitalizations usually occur in young children under the age of 6 months, occasionally in kids up till the age of 2 or 3.
And let's say I'm a high-risk patient and symptoms are worsening. When is it a good time to go to the emergency room?
And when possible, contact your own healthcare provider rather than go to the emergency room. But first of all, I would say they should have a relatively low threshold because, again, when it comes to both COVID and influenza, early treatment, if they turn out to have either of those conditions, seems to be beneficial. So I would say they should have a relatively low threshold for at least contacting their healthcare provider and saying, hey, here are the symptoms. But in particular, I would say symptoms that would warrant more immediate attention from a healthcare provider would be any compromise in their breathing. So shortness of breath, difficulty in speaking in full sentences, and high fever. But again, I would say have a low threshold. You don't have to figure out at home whether you're so sick that you need to see a healthcare provider. You don't need to figure out whether you need treatment or not.
With an increase of these cases, are we at a point where hospitals should be seriously concerned about overwhelming cases or navigating workloads?
Yeah, I think it's already happened, quite frankly. I mean, I'll give you an example. Our children's hospital, which is a big children's referral hospital, has seen not quite, but almost a doubling of pediatric emergency visits when RSV started. And as a result of that, there were terribly long lines for people to be seen. And so we've done offloading, and I think many hospitals will have to do that, which means we've opened up alternative sites of evaluation and have sent some kids waiting for prolonged periods of times to other ERs so that they can be seen quicker. They're triaged quickly to see which one would really need to be admitted to a children's hospital and which one will probably be able to be sent home. And by doing that triage earlier and testing earlier, you can hopefully set up a system so that not everyone is waiting in a crowded ER where there's a risk that the infections will spread even more.
RSV and the flu, they've been around for a long time. I know RSV doesn't have a vaccine just yet, but why this unsettling uptick now?
Certainly on the RSV and influenza front, and specifically the concerns there are, did we do a decent job of protecting ourselves from influenza and RSV in the two previous winters? And now that, for a variety of reasons, as a nation, we're a little bit more comfortable taking masks off. Certainly everyone's looking forward to getting together. And maybe that relaxation has allowed these two viruses, which we see every winter, but which we were relatively spared the last couple of winters because we were so focused on COVID.
And then, of course, our vaccine rates for influenza are far below what they were prior to COVID. I mean, for adults, they're 26% the last time I looked. For children, they're in the low 40s. We're often much higher than that. And I think people are vaccine shy for all vaccines. That's unfortunate, in my opinion. But if you take that flu vaccine, you're much less likely to be in the hospital with flu. You're much less likely to die from flu. And the same thing applies to COVID.
What precautions would you suggest someone take? We're in the midst of the holiday season. Everybody wants to see family, friends they haven't seen in a while. What do you suggest we do?
So, number one, the fundamentals still apply. So frequent hand washing is important. Vaccination is important. It's if you have to cough or sneeze, cough or sneeze into your elbow. If you feel sick, stay at home. I know it's a shame to miss these big events. They only come once a year, but it's the responsible thing to do for you to stay home from work or stay home from that event if you're ill.
So I suggest that one, it's not too late to get the flu shot. If you're elderly, when you get the flu shot, request a high titer flu shot, meaning a flu shot that's specifically geared toward the elderly that contains about 4.5 times the amount of antigen compared to the regular flu shot.
Any thoughts on COVID reinfections as we move forward into the new year?
Too soon to tell is definitely the answer. We're still learning about long COVID, and we're certainly still learning more about reinfections. And so both those are a little bit unknowns. But I am concerned. I would think to myself that those multiple infections, if somebody has 2 or even 3 infections, I would really worry about those individuals and the exposure. But I would also say that for somebody who is healthy and has a normal immune system, those subsequent infections, because your body will be able to respond so quickly to the infection, perhaps that will decrease the inflammatory elements of the infection, and perhaps those inflammatory elements are the pieces that contribute to long COVID.
Unfortunately, the news is that yes, these reinfections are going to continue to occur. And it's just people say, when are we going to get rid of COVID? And I say, when are we going to get rid of bad storms and crime and poverty? Yes, they will continue to evolve, and every one that evolves is slightly more contagious and slightly more immune from the immunity that you got from either your repeated episodes of COVID or the vaccines or both. So I expect to see that COVID is here for the foreseeable future until there's a dramatic breakthrough in vaccines that can target common sites that don't mutate. And that's just not on the horizon as we speak.
Thank you, Dr. Bader and Dr. Farber. I'm Linda Gaudino, News 4 New York.